thank you. You have the last word on this.
Again, going back to this, we're still limiting who and who cannot. We're not letting them go out to bid. And if they come back and they change their ways, it's still a whole arduous process that they have to go through to actually become approved. By that time, the bid has already been closed, and we've, again, paid higher prices for work that could have been done by another company. And, you know, anytime you say that you're limiting who can and can't benefit from, you know, bidding on projects within the Commonwealth of Massachusetts, you're saying that you're against free market.
Okay, thank you. Thank you, gentlemen. All right, the next question I want to bring up, and we'll start with Joe this time, is on the topic of immigration. This past spring, the Massachusetts legislature narrowly defeated an amendment to the budget that would require adults applying for public benefits to provide proof of legal residence. Do you believe that those who apply for and receive public assistance should prove that they are in this country legally and are entitled to such assistance? And if you do believe, why or why not? And Joe, we'll start with you. You have 2 minutes.
Well, I'm going to give you the simple answer is yes, they do. They should have to prove legal residence here. When you're not paying into a system and you're collecting benefits out, it's again draining off you, the taxpayer, to fund for benefits that should be going to people who are legal citizens. You know, I don't need the full 2 minutes for this because I find it out of control that we can, unbelievable that we can say someone that's illegal can receive any sort of funds from the state.
All right, thank you, Joe. Tom.
Fran, this is one of those issues I think that Joe and I are in complete agreement on, total agreement on. I voted on that amendment, and I voted to require identification for all people applying for public assistance. You know, I call me not so smart, I guess, but I can't understand why we wouldn't want that type of identification. I think that's an area Joe and I completely agree on. But I will use the rest of my time to talk about this major policy problem. Immigration, illegal immigration, to me, is one of the 2 most important challenges we face in this country. And the federal government has completely fallen down on their responsibility to create and pass a meaningful immigration law. We have a tendency to talk about the illegal side of it, but how about the legal side of it? When my grandparents came here from Ireland, it took them 8 months from application to integration. From application, they came across the ocean, came into Ellis Island, and were welcomed, and they learned the language, and they learned our rules, and they passed the test, and they became citizens. Now it takes 8 to 12 years. 8 to 12 years to become a citizen of this country. And we've got 12 million illegal immigrants in this country, partly because the federal government has lost sight of what it takes to become a legal immigrant. Now, the reason I say it's one of our biggest problems is because of all the mandates that have come from the federal government. An illegal citizen can come over the border and enroll their children in Kingston Elementary the very next day, and we have to pay for it. I believe strongly in social justice. That's not justice. It's not fair to the people that pay the bills. And I would call on Congress, as I already have in writing, to fix this problem, or the state legislatures in this country will call a constitutional convention and fix it for them.
Joe, 1 minute to respond.
You know, and that's something that, again, Tom, you and I are probably, that's one of the few issues that we are going to 100% agree on, is that I'm going to tell you right now that if the federal government doesn't fix it, as a Massachusetts state legislator, I would be leading the charge to make sure that we here in Massachusetts fix it. And we have to get this right. But in the meantime, we cannot continue to sustain giving benefits to illegal immigrants in the state of Massachusetts.
All right, thank you. Anything else on that one? We'll move on. All right, we'll move on to the next question. And Tom, you'll start off with this one. This one is on the topic of health care. Massachusetts, as we all know, was well ahead of the nation in the implementation of health care for all. How do you think the Massachusetts health care plan is working, and what do you feel will be the impact of the national plan on Massachusetts' present health care program?
Well, I
Tom?
think it's important that we give credit where credit is due. The Massachusetts healthcare program was developed by a Republican, Mitt Romney. And although I didn't support Mr. Romney, I thought his plan was brilliant. It was based upon the premise that the uncompensated care pool, i.e. the money that's used to pay for people without coverage, had become so large and then distributed into the payments, the premiums of those of us that pay for it, that it was out of control. And that if we created a subsidized system, people would get proactive health care. They would do preventive care. And we would decrease the overall cost of health care because people wouldn't be getting treated for everyday problems in the emergency room. I thought it was a brilliant plan. Mr. Romney said at the time, and he was right, that the first challenge is to get everyone signed up. We have 97% of our citizens signed up today. 97%, the only state in the country. Once again, Massachusetts leading the way. Not a surprise. The rest of the country knows about Massachusetts. We perhaps don't appreciate it the way we should. Now the charge is to make sure we start driving down costs. In 1998, we passed a health care reform bill to start the process of driving down costs. In 2010, we passed another health care reform bill where we actually capped increases to 3.2% for small businesses. We actually included autism for children in this most recent round of legislation. Massachusetts right now is focusing on cost containment for health care, while the rest of the country is 5 years behind us. Once again, not a surprise. And I do thank Mitt Romney for that.
Thank you, Tom. Joe, do you need me to repeat the question? Are you okay?
If I understand correctly, it was my view on Mass Health, and then followed by what do I think that the national plan
Right,
will do to.
right. How do you feel our health care plan is going, and what
Well-
do you think the impact will be of the national?
Well, let's start with Mass Health is an unsustainable program. It's far too expensive, and yes, the costs have to be driven down on it. How do we get the costs down? Well, again, it ties back to starting with illegal immigrants who are taking abuse of the system and able to get on, and it's the corruption factor, and they don't have to, the fail-safes are not in place where people have to actually legitimately prove. They can show up with, and I've talked to people in the hospital. I've talked to them when I was there when my son was born, and I've asked them, what is the process? They say, we have people that come in with falsified W-2s. We have to do a better job as the state in actually legitimizing who gets on and who gets off of Mass Health. As for the national plan, what that's going to do to us, well, yes, it is modeled after, and I know that there's plenty of criticism on the fact that, things are coming out of this bill that people didn't think were actually in there. I think what that does to us is that money that we would have been getting from the federal government to help actually offset the cost of this Massachusetts healthcare system is going to make it even farther unsustainable to us.
All right, thank you. Tom, I want to follow up with you. Can you just talk a little bit about what you think, and you have 1 minute for this, the impact of the national plan will be on Massachusetts plan?
So it'll be spread out over 6 years.
Okay.
The first thing we're seeing, Fran, that's going to affect us this year is the two issues about pre-existing conditions and the issue about children being able to stay on their parents' programs until they're 26 years old. Every year there are more elements that come into play. I'm not particularly, it's almost like the national core standards for education. I'm not opposed to what the federal government wants to do because it's modeled after what we've been doing, and we're light years ahead of the federal government. This is not the dog wagging the tail. This is the tail wagging the dog. Massachusetts is leading the way, whether it's on core standards or whether it's on health care. I would say this about national health care. I opposed it, and the reason I opposed it without having even read it was because I believe that nothing good can come out of a bad process, and that was a bad process.
Thanks. Thank you, Tom. And Joe, I want to follow up with you. You talked a little bit about the fail-safes not being in place. What fail-safes do you think needed to be in place? What